Nagaland sees another surge in the number of coronavirus cases in the state, taking the state's tally close to the 900 mark. Longland becomes the 10th district to report a case of the virus from the state. Nagaland government informs that the existing guidelines with regard to the lockdown in all parts of the state shall continue to remain operative in the state further up till 31st July 2020. And 1 lakh cases in just 3 days takes India's COVID tally beyond 9 lakh. Total coronavirus caseload in the country surged to 9,06,752 with 23,727 dead. Well, those were the headlines. Well, hello and welcome to this news broadcast from News and Trends. We begin this bulletin by taking a look at the COVID-19 update from Nagaland. In another surge in the number of coronavirus cases in Nagaland, the state today reported a total of 51 cases, taking the state's tally close to the 900 mark. The cases were reported from 6 districts across Nagaland. Longland district, which had remained COVID-19 positive free, along with Kifri district, today registered 2 cases of COVID-19, making it the 10th district to have reported the case of the virus. Kifri remained the only district without any reported cases of the deadly virus as of today. In his couple of tweets today, State's Health and Family Welfare Minister S. Pong said in his first tweet that 33 new cases of COVID-19 positive have been confirmed, 24 in Kohima, 3 in Dimapur, 2 each in Perin and Longland, and 1 each in Mokokchung and Zenaboto. In another tweet this afternoon, the Health Minister said 18 more positive cases of COVID-19 have been confirmed. This time, all the cases were from Perin. Dimapur, the most cases reported of the pandemic, has reported 322, of which 160 have recovered and 162 active. 15 of the active cases are mild as per severity of the cases, while 147 are asymptomatic in nature. The second worst hit district, Perin, has reported 235 positive cases with 81 recovered and 154 active cases. Kohima comes next with 182 reported cases, 71 recovered and 111 active cases. The district task force, which met yesterday under the chairmanship of DC, maintained that active surveillance is on for early detection and also to break the chain of transmission of COVID-19 infection in all the containment zones at Nagaland, Jotsama, Kezeke and AG Upper Colony. At the meeting, CMO Dimapur Dr. Vezokholu informed that the containment zones is for a period of 28 days including 14 days of home quarantine, during which house-to-house surveillance as per SOP, thermal screening for influenza, fever, cough, diarrhea and other suspected cases will be carried out by the medical teams in all the areas for onward submission of the report to the health agency. An addition of 1 more case means Mokokchung now has 5 positive cases with no recoveries as yet. Zenaboto's tally has gone up to 5, but with 3 recoveries, active cases now stand at 2. Longland, meanwhile, has now reported 2 cases of the coronavirus infection. With this, the overall tally of the state as of 3 p.m. this evening stand at 896 positive cases with 556 active and 340 recoveries. The recovery rate in the state is at 37.94%. Nagaland government has informed that existing guidelines with regard to the lockdown in all parts of the state shall continue to remain operative in Nagaland further up till 31st July 2020. A DIPR report said this is in continuation of the Chief Secretary's order dated 29th June 2020, which extended the lockdown in the state till 31st July 2020. Nagaland Legislative Assembly Speaker Sharingain Longkumar has dismissed the petition filed by NPF leaders Chatusu Sazo MLA and Imkong El Imchun MLA, who had sought disqualification of 7 NPF MLAs. In an order issued today, the Speaker said there was no sufficient ground for presuming that the 7 MLAs had voluntarily given up the membership of their original party, that is the Naga People's Front (NPF), and therefore not liable to be disqualified under Para 21A of the 10th schedule. With 28,498 fresh cases recorded in a day, India's COVID-19 tally sprinted past 9 lakh today, just 3 days after it crossed the 8 lakh mark, according to the Union Health Ministry data. The total coronavirus caseload in the country surged to 9,06,752 and the death toll mounted to 23,727 with 553 people succumbing to the disease in the last 24 hours, the data updated at 8 a.m. today showed. Of the total instances of the infection, the number of recoveries stood at 5,71,459, leaving 3,11,565 cases active. Thus, around 63.02% of patients have recovered so far, an official said. The march of coronavirus infection in the country has picked up pace, with the number of cases increasing by more than 26,000 for the 5th consecutive day. It took 110 days for the COVID-19 cases in the country to reach 1 lakh and just 56 days more to go past the 9 lakh mark. Maharashtra has reported the highest number of cases, followed by Tamil Nadu, Delhi, Gujarat, Karnataka, Uttar Pradesh and Telangana. In the northeast, Assam has reported 16,806 instances of the infection. A total of 2,080 were reported in Tripura, 1,626 in Manipur. Arunachal Pradesh reported 387 cases, Mizoram 233, Meghalaya 318, while Sikkim has reported 192 cases. The overall number of global coronavirus cases has increased to more than 13 million, while the deaths have soared to over 5.7 lakhs, according to the Johns Hopkins University. As of this morning, the total number of cases stood at 1,30,99,088, while the fatalities rose to 5,72,981, the university revealed in its latest update. The US accounted for the highest number of cases and fatalities with 33,63,056 and 1,35,605 respectively. Brazil came in the second place with 18.84 lakh, India comes third with 9.06 lakh, Russia in fourth with 7.32 and Peru in fifth position with 3.3 lakh cases. In other news, in Assam, all the major rivers including the Brahmaputra are in spate. Floodwater caused major damages to infrastructures including embankments and destroyed crops. Nearly 22 lakh people are affected due to surging waters in 22 districts. 45,000 people are shifted to relief camps. 95% of the Kaziranga National Park are underwater. Chief Minister Sarbananda Sonowal, Union Minister Rameshwar Telly and Water Resource Minister Keshav Mahanta are visiting flood and erosion hit Jonai district today. The Chief Minister will hold 2 review meetings at Jonai, one with Water Resource Department and the other with Dhemaji District Administration. Deputy Commissioner Montha Vasilin K has notified that COVID-19 positive case has been detected at quarantine center in 11 IRB camp Aboy under Mon district yesterday, and it has become necessary to take all required precautionary steps to mitigate the possible spread of COVID-19 for public health, public safety and public order. Therefore, in the interest of public health, public safety and public order in Aboy subdivision and in exercise of the powers conferred upon Section 144 of the Criminal Procedure Code 1973 for prohibit movement public within 100-meter radius of the containment zone at 11 IRB Aboy camp. According to DIPR, the DC has passed this order ex parte under Section 144(2) CRPC. This order will come into force with immediate effect and shall remain in force till further orders. Anyone violating the aforesaid order will be liable for punishment under Section 188 of the Indian Penal Code. Continuing with the inspection of NEC-funded projects, Nagaland APC Kikheto Sema and team visited the Botanical Garden cum Recreation Park at Jaluki today. Kikheto Sema expressed satisfaction with regard to the progress of the ongoing work and advised the contractor to expedite the work, stating that perhaps it would be the first botanical garden and recreational park in Nagaland funded under NEC. He also directed the Horticulture Department for furnishing the latest progress report of the state project. Meanwhile, interacting with the departmental officers, Sema regretted that many a times the infrastructures created by the government are not taken proper care after completion, and advised all concerned departments to make judicious use of the facilities. Mentioning about the beautiful botanical gardens and recreational parks in other cities and hill stations of our country, which gives opportunity to the people, especially elderly people, to enjoy the beauty of nature, Kikheto Sema regretted that none of the towns, district in Nagaland has such facility worth the name. With or without NEC funding, like-minded people should come together and create botanical gardens and recreational parks so that we do justice to at least the elderly people who can go for a walk and enjoy the nature, flowers, different species of trees and birds, Kikheto maintained. Further, he wished that like-minded friends circle, colony wards can come up and start in a small way. Taking the advantage of visiting the botanical garden at Jaluki, Kikheto Sema also felt that DCs of every district should take the lead in discussing the issue during DBDB meetings. Find out availability of land where sometimes unused government land can be converted for the purpose through policy decisions. It may not be of huge size, but all concerned departments can chip in and make an innovative plan in each district, he suggested. He further observed that the time was coming for the young leaders where they should not regret, and added, "Let us plan for tomorrow, for the city town is known by the people only if uniqueness is being created," Kikheto remarked. The APC was accompanied by Additional Director IPR Tokshia Sema, Assistant Development Commissioner Planning Department JASA, Director Horticulture Dr. Ilithang, and officials from Horticulture Department.
Botanical garden ko to botanical laga to Nagaland to itu first time one and only first time aha time te itu thik hona goilo dosra mangle ke nisi ne dibo to ha jalukin sana dangur mati na thaki ko hoile ke I want each district to have outskirt hoile ke agree and alike will discuss. Let the DC nation, let the people love their own people, own area, own state. Attraction nahi to hima prota hiba sab bhaisho gele city tower kya ase man nai kohima ta dangur police point pi kya ase nai bane no high school secretary road to olop dangur ase MPCC khani tati flower rakhe hoile to pot prakin ka pare unko chunte pe dangur area nai kun bas district paisha nai to. How can we leave behind a legacy like that to our generation?
A joint meeting of Puroboto Sub-Division Task Force and Sumi Aphiemi Hoho SAH was held with regard to purchase of TrueNAT machine. The meeting was held under the chairmanship of ADC Puroboto T. Moa Lemtor at DB Hall ADC Office Puroboto today. According to a DIPR report, SAH President Inavi Su highlighted on their contribution of Rs 20,000 to SDTF earlier. It was also decided that the purchase of the TrueNAT machine in Puroboto will be done through free will donation. Medical department and administration was entrusted to take up the matter. He said that although Puroboto falls under Zinoboto district, it is not feasible to go and test from their district Zinoboto headquarters due to various reasons. SMO Puroboto Dr. J. Hokra Sema acknowledged the Hoho's concern for the people of Puroboto and briefed on the standard operating procedure. He also highlighted on the manpower necessary and maintenance of the machine. He further briefed the members on how the doctors and his team are working day and night for the returnees and suspected tracings, and also said SDTF Proboto team is collectively working to contain the pandemic. The ADC appreciated the HOHO for the initiative to procure the TrueNAT machine. The meeting also discussed on disposals of materials, safety measures, maintenance of the machine, backup, etc. With that, we come to the end of this bulletin, but before we leave you, here's another reminder that you can send in your videos at the WhatsApp number flashed below and be part of this venture of being a citizen journalist. Do let us know what's happening in your village, your town, your district or your locality so that we can share your videos to the rest of the viewers watching this broadcast. Meanwhile, stay safe, practice safe health hygiene and maintain social distancing wherever you are. But most importantly, take good care of yourself. Thanks for watching.